Hello, my name is Paul Leong. I am a board-certified facial plastic surgeon. I wanted to talk to you a little bit today about stretch marks. In my practice, we quite frequently see patients who have been bothered, often for a good long time, with stretch marks on various parts of their bodies. Typically, they have two key questions they have about this. First of all, they're wondering, gee, why did I get these stretch marks? Is there something that I'm doing, or is there something about me? And then, quite naturally, they have the question, is there something I can do about it? Is there an effective treatment, an evidence-based treatment, hopefully, for stretch marks? So, in terms of the first question, why do particular people get stretch marks? Well, there's kind of two components to the creation of stretch marks. One of them, quite obviously, the stretching of skin, stretching of tissue has quite a bit to do with it. So, as one might expect, there's various things. Pregnancy, of course, breastfeeding, if you simply gain a lot of weight and then lose a lot of weight, all of those things can have to do with causing stretch on human skin and therefore stretch marks. Now, you might be saying, well, certainly that's obvious, but there's another component that's probably at least as important, and that is, and this question becomes obvious because many patients ask, well, other people have gained and lost weight, other people have had pregnancies, and they don't seem to have stretch marks. Why do I have them? The other very important component is there's a hormonal balance. If the hormonal balance in the body and how it affects the skin and also the layers right under the skin, the epidermis and the dermis, are not quite right, and then patients are a lot more susceptible to getting stretch marks. So if you have the stretch and you have the hormonal imbalance, then you can very often end up with these stretch marks in various parts of the body. Now, in terms of the second question, how do you treat stretch marks? Well, I'll tell you, for years, this has been a source of quite a bit of frustration, I think, for physicians like myself, and also, obviously, for my patients, and patients, around the world. There have been all kinds of lotions and creams and various things that have suggested that they could either reduce the onset of stretch marks, or they could treat them to some degree after they're present. And I can tell you, the evidence base, the medical evidence to support these sort of lotions and topical creams is often very, very scant, and patients often end up quite disappointed. The good news is that the FDA, which is a very high standard for evidence, has recently approved a kind of device, a fractional non-ablative laser, and indeed a very specific, one specific laser that we use here in our practice. It's called the Palomar Fractional 1540 laser. In order to obtain an FDA approval, what you need to do is prove that, number one, to the FDA, to the government, that it's safe, meaning that there's been no untoward extreme hazard or risk with using this laser for this purpose. But also, you actually have to present evidence that there has been some consistent effectiveness. And so we're very happy that we have this laser in our practice. Again, the only FDA-approved laser in the United States effective for the treatment of stretch marks. One thing I want to emphasize in terms of using lasers or any other treatment approach for stretch marks, certainly I'd love to be able to tell you that if you've got quite bad stretch marks, you can treat with this laser and it will completely eliminate them. That is in general not the case. What we find we can do, though, is we can quite substantially improve them on a quite substantially consistent basis. And so we're always very clear when patients come in, when we use technologies like this, what can it do, what can it not do? But we certainly believe, and I think many, many other people believe, that this is the most effective and certainly the most effective treatment that is supported by evidence here in the United States today. So we look forward, if you have concerns about your stretch marks, if you'd like to have a consultation and come in and talk to us about this treatment modality, we certainly look forward to meeting you. Thank you very much.